Good morning, everybody. I think we're going to get started. And I'm very excited about this particular topic we're covering today. It's actually part of a much larger short course that we are busy creating with the Colleges of Medicine of South Africa. And it's going to be part of a national training for clinical supervisors on advanced mentoring skills. So this is just one of the parts of a larger training. And I'm going to be specifically focusing on affirmative work environments for clinicians and become clear a little bit on how and why we are covering this particular topic. And this kind of what we're covering today is actually sort of standing at the very edge of where we are evolving to as a society. So I'm going to look microcosm today of what kind of environments do we want to work in. But actually, this is a much larger question in terms of what kind of world do we want to live in as a society? I mean, if you look at the moment at the news and if you look at what's happening worldwide in politics and the wars we are seeing overseas, some of the struggles and battles we're also seeing even within South Africa, there's questions we have to ask ourselves as humanity in terms of, what kind of lives do we want to live and what kind of workplaces do we actually want to show up for? So to do this, I'm going to first talk a little bit about what it is to be human, and particularly about the fact that making mistakes and things going wrong is part of being human. And an important part of that is in how we deal with that. And then I will move on to the conceptual framework that I've actually developed for my master's and which I'll be taking into my PhD, which is going to be particularly just looking at the neurophysiology of emotion and how it drives behavior. My medical office is already quite familiar with some of those concepts. And I'm going to use that to talk particularly about how we build an appreciative feedback culture and what that potentially looks like. And as I say, this is a bit of a vision for the future. It's not the way we roll usually in society. And then lastly, I'm going to have some very practical feedback tools that I'm actually going to be teaching you guys. So let's start first looking at us as human beings. And I want to go right back to 1977. I did this presentation last year. Some of you might remember this story. Tenerife Airport, 27th March, 1977. And the reason why we're suddenly at Tenerife Airport is because that day is famous for the worst aviation accident in history up to date. 583 people died when a KLM flight actually took off on a runway. It was taxiing on a runway where there was a Pan Am standing across the runway. There was heavy fog. The captain missed a couple of cues from a very bad English from the flight controller and basically tried to leapfrog this Pan Am and took out the whole middle of that aeroplane. And everybody on the KLM flight died and 335 people on the Pan Am flight. So the reason why this is important is that the person who was piloting this flight was a man, Captain Jacob van Zanten. And this wasn't just any pilot. This was one of the most prestigious pilots in KLM. So he was the chief pilot, corporate vice president. He was actually the director of safety at the airlines. And he was a family man and he was a nice guy. Everybody liked this guy, more than 30 years of experience. It was somebody that people really looked up to. And you can imagine this as your senior consultant in your department or the HOD of a particular, it's the guy. And when they looked at the black box recordings trying to figure out what happened, they discovered that both the co-pilot and the flight engineer had picked up concerns. Hold on, are we sure everything is clear? Are we sure we've got flight clearance? But captain was grumpy, they were in a rush, and he was like, no, it's fine, it's fine. And neither of them queried or stopped him from actually taxiing off. So there was obviously a massive investigation, and classically in medicine, what would we do? We would nail this captain to the wall because he clearly made a mistake. He misunderstood some of the flight clearance instructions and he taxied on a runway that he should not have taxied down on. But what was incredible when KLM actually did the investigation, because they realized this man clearly made a mistake, but he is their top pilot. He is one of those amazing, extraordinary people. If he can make a mistake, anybody can make a mistake. And so the conclusion of the report, which revolutionized the airline industry, is that the issue was not just the fact that Jacob made a mistake. The issue was the organizational culture, which included two major things. The fact is that the captain's always right, or think of head clinician. And the second one is that there was a culture also in the airline industry where the pilot had a certain amount of, halo effect, can do no wrong, and no value was placed on the opinions of the crew. And it was not that he didn't necessarily even have to be a very nasty man for this to happen. That's just the way the hierarchy worked. And does that feel a little bit familiar from a medical point of view? So what's happened is that the airline industry massively started cleaning up their organizational culture. They also looked at checklists and all kinds of other things. And then they actually massively started reducing the amount of airline accidents that was happening through addressing things like organizational culture. And medicine looked at this with interest. And there's a document that came out then in 1999, published by the Institute of Medicine. This was in America. And it's a beautiful report. It's called To Err is Human, Building a Safer Health System. And they were starting to look at this fact, well, human beings, doctors make mistakes, but how do we pick those mistakes up? So there are amazing amount of articles and records that's been written about this, but medicine has not been very good at actually responding to changing the culture. So the airlines very much got on it. And between 2001 and 2006, so sort of the decades after that aviation accident, during that period, there was actually no deaths on any major American airlines during that time. But just as a comparison, this is in America. In American hospitals, 250,000 to 500,000 patients were killed due to preventable medical mistakes. That's the equivalent of crashing 1,400 fully loaded airplanes with no survivors. And these stats, unfortunately, has not massively improved over the last 2 decades. So one of the statements from that is that medical mistakes are human mistakes committed within a human system that's inadequately designed to catch and neutralize those mistakes in time. So the idea is not to try and create perfect doctors, because we are human. There's no ways, no matter how experienced you are, no matter how much you know, no matter how determined you are not to make mistakes, we're all going to have bad days. We're all going to have times that we miss things. And you can see how often the aviation industry is actually quoted in many of these articles in terms of we can learn from how the aviation industry actually shifted things. So in medicine, the big thing, the mechanism of human mistakes within the medical field is based on 3 things usually. Either misperceptions, you misread something, or you examine the patient and miss some obvious thing, making an assumption, so picking up that vial and thinking it's saline and not realizing it's potassium, and communication. So somebody saying one thing and you hearing something different or misunderstanding, and all of these things lead to various medical errors. So these mistakes definitely increase when people are under pressure. And we can't ever, sometimes people are trying to find that one root cause. You know, when you're in a mortality and morbidity meeting, we want to find the one thing that now caused this problem. But usually there's a whole lot of factors that leads to a mistake. So again, like Jacob van Zanten, rather than focusing on the person who made the mistake, rather focusing on why did the environment not catch that mistake in time. And therefore, in the medical setting, when we talk about organizational culture, being able to pick up mistakes before they happen and be able to prevent future mistakes if a mistake did happen is all depending on how we give feedback. And so we're going to talk a lot today about feedback culture. So there's actually quite a lot that's been written in WBA. We are massively driving towards work-based place assessments and postgraduate education, where feedback is going to become a core part of postgraduate education. And so there's a lot of research done around feedback at the moment. And the key thing that's been found of feedback is being able to create a relationship of trust within a department. So I wanted to compare 2 types of organizational feedback cultures. These are both 2 extremes, and most departments will have a mixture of these 2. And there's a little bit of a tipping point, at which point would you say this department is more on the one side or more on the other side. So the first side, obviously, which is where we're trying to move away from, is what I'm calling a depreciative feedback culture. And it has certain sort of underlying beliefs. And this is the way, well, certainly the way I was trained, and certainly I think experiences you might still have had at medical school and in some departments. So it's this impression that you should already know that, you know, that we should be coming and having read all the guidelines and done all our medical training, and therefore we should already be aware of things. People are motivated, or they try and motivate people through humiliation. Why don't you know that? You should be reading more. Why have you not looked that up? The Navy SEAL imperative, the surgeons always love bringing this up whenever I teach this to surgical departments. They're important to throw people into the deep end, and, you know, they must cope under stress, and that's when they learn the best. The more stressed they are, the better they learn. The idea that by telling people stuff, they'll do it. You just have to tell them again and again and again. The hierarchy imperative, so the intelligent people at the top teaches the minions below. And this sort of fixed mindset when you look at people and go, okay, that guy knows his stuff and that one does not know that stuff, and that person will never learn, and this person obviously. So this idea of some people know stuff, and rather than, so let's look at what an alternative culture would look like. And as I'm saying, we're actually looking at a vision for the future, because society pretty much operates like this. Think of social media, right? That's the way we roll on Instagram and Facebook. So an appreciative feedback culture is this idea, and we quite often say that, but we don't always act like that there's no such thing as a stupid question. There really is possible to not know stuff, even if you're a senior consultant, to motivate people through affirmation of what they're doing well, rather than motivating them through pointing out what they're not doing well, to prepare people for stressful situations before you put them into those stressful situations. So the opposite of the Navy SEAL affirmative. To understand that people learn through reflecting on things rather than just being told. So we learn ourselves by noticing what we can or cannot do. To realize you can learn from everybody, even a junior nurse on your ward might be able to teach you something that you didn't know. And the growth mindset is that all of us can learn anything. We just need to be given the opportunity and time to practice. So to shift from one of those to the next, we need to be able to actually start looking at how to understand why we don't do that. We all know this, right? It's completely obvious. Surely we all want to be in an appreciative feedback culture. So why are we so nasty to each other? So in this little module, I want to particularly summarize